I am honored and thrilled to be here today to talk with Kimberly Richardson, one of the Stovall Award winners, and the first Stovall Award winner who's also an NCCS CPAP member and Elevate ambassador. So we were thrilled that you were nominated and chosen by the selection committee and know that you are absolutely 100% deserving of this award. I wanted to start with just reading a quote from Alicia Staley, who was one of the people who wrote a nomination letter for Kimberly, and I just want to read you some of what she said. Alicia said, I've had the opportunity to work with Kimberly as a fellow patient advocate in the cancer communities. I first met her through my work in social media for breast cancer communities. Together, we've participated in a number of patient-led conversations on social media on how to better support patients throughout their cancer journey, find new clinical trial opportunities, and address disparities in access and care in all cancer communities. At every event, Kimberly provides compelling ways to improve the lives of cancer patients by advocating for better care, more information, and more effective patient-doctor communications. She is relentless in her singular pursuit for a better patient experience for those dealing with cancer. Kimberly is a true champion of the patient perspective with a deep understanding of how all stakeholders interact within cancer communities. She approaches her work with a fierce dedication to honor, integrity, and empathy. Her approach to working with all stakeholders is a masterclass of diplomacy and collaboration. She understands the problems facing the industry and has a creative and tactful way of navigating some of the toughest conversations around access, equity, and equality for cancer care.
Wow.
I know, pretty amazing. I mean, it's all true, but it's nice to hear it, huh?
Well, we all want our flowers while we're living, right? So, um, right back at you, Alicia. To be honest with her, I thank her for those words because it's been such a journey for me since since both diagnoses, right? Since 2013, being diagnosed with ovarian cancer, and how that journey started for me, right? It's for everybody. It's, oh my God, I have cancer. But on top of mine was this miscommunication.
Tell us more about that. How did that motivate you to become an advocate?
Oh my God. Well, for the first year after diagnosis, literally, I was in therapy. It was just that bad. Our communication was really poor. I am a person who wants to know what's happening to me and to be able to fully understand what's happening. And I unfortunately had a doctor who was more or less, just do what I tell you, this is the chemo you're taking. This is the option. You don't have any options. The things that were happening to me during the treatment, she wasn't necessarily interested in. It was like, you're gonna go through all of the treatment, despite the fact that the neuropathy was getting really, really bad. But I think the thing that changed me during that process was I was a person who was leading her own non-for-profit. I was an adjunct professor. I was in front of students. And now I didn't have a voice. Mm. I questioned everything. Like, well, maybe I should be quiet because this woman knows more than me, and I don't know anything about this disease, and I had a rare form, and there wasn't a lot on the internet, so maybe I need to trust her and just shut up, right? But every part of that process was tearing me apart. I was emotionally broken. Mm. And I think after I came through therapy for about 6 months, after treatment stopped, I began to rethink. And I think it was fueled from anger, if the truth is told. Mm-hmm. I've been quoted as saying that if I saw her on the street, I'd probably throw her under a bus. I know. I mean, I was really angry, mm-hmm, and wanting to understand more about my disease and making sure that other patients didn't go through that process, didn't have, mm-hmm, that experience. It's not necessary to have that experience. I mean, in just in terms of humanity, right? Here's a person dealing with dying, or the or the possibility of dying, at least from their standpoint, because they don't know enough about their disease.
Mm-hmm.
And I think just some humanity and kindness and compassion is could be more afforded from the provider standpoint.
Right.
But if you can't get it, I think that's one of the advocacy issues that I sort of went towards. If that's not the case for you, if you don't have that many options to choose from, like you could just fire your oncologist and find another, then you need to advocate for yourself and you need to find that voice. And as you said many times, we shouldn't have to be in that position, but oftentimes we are.
Mm-hmm.
And so that's the reason I think where my advocacy started. I wanted to learn as much as I could about cancer research. And so, of course, I started like everybody else, put on the teal t-shirt, went to the 5K walk, and I was like, this isn't it for me. It's for other people, but it's not for me. I got involved in legislative advocacy and did the Hill. And those folks were folks that I had seen in Chicago. So I wasn't feeling the sort of celebrity of it all, of to going to the Hill to see my Congress people. In fact, it was difficult for me at first because they had seen me on so many other issues around community and economic development in Chicago. And now I had to tell them personal stuff about me, right? Whereas before it was like, we will need you to do this, this, and this. And they'd see you as this strong advocate, right? And now I had to come in and say, well, now I'm a cancer patient advocate, and talk a little bit more about things that were so much more personal than they were professional. But I got past that. And but still in all, realizing that together awareness and legislative advocacy was important. But again, it wasn't meeting the need I felt that most patient advocates need to know. Why am I taking this kind of chemo? Are there other treatment options that could be available to me frontline? When we don't have those kinds of questions, you do what you're told. So I think that's the reason why I pushed toward getting involved in research advocacy. And what it did for me, honestly, it made me see other people's perspectives, right? It helped me see that maybe my oncologist was shutting down because she didn't have any answers for me, having a rare form of ovarian cancer, that the research hadn't caught up with granulosal cell tumor that I had, that there's so much more information out there about epithelial cancer. So it, again, it softened me a bit and it helped me to see other people's perspectives.
Wow. So when you came to the Elevate Ambassador program, you had multiple ideas for projects. And I know we thought, oh, maybe she's just too ambitious. How's she going to be able to do all this? But you did. You did all of them. And you added to your list of projects once you connected to other advocates as part of the Elevate program. And your advocacy spans so many different types of efforts, from directly supporting patients to legislative advocacy to research advocacy. So how do you decide what to work on and how do you manage it all?
Oh, wow. Well, in the beginning, as a patient advocate, you're just so happy anybody wants to talk to you, right? So you're like, yeah, I'll be on your panel. Yeah, I'll do your podcast, till you get to the point where you're going, well, what else is there to say about my lived experience? And particularly since, it's almost 8 years since my first diagnosis, you start feeling like you are the cancer story, that there's not much more to you. So one of the things I wanted to do was I wanted really to look into other issues that are affecting cancer patients. And the best way for me to do that is to get involved in whatever somebody else is doing. So for me, it was initially it was working with WCG, finding out what the pharmaceutical companies were thinking. They wanted to know what a patient's perspective was on clinical trials. And I was like, yeah, this is a really important issue for African Americans and other people of color. Why hadn't we ever given that any thought that we needed diversity in clinical trials, right? And so I said, well, there is a place where I have a voice. I wanted to learn more about emergency medicine. So again, another space where I felt ovarian cancer patients, when we have so many of our symptoms, we rush to an emergency room and sent back home with Tylenol, when largely that's the difference between a stage 1 and a stage 3 diagnosis, because those symptoms are not being caught on a differential. And so I sort of start looking at how is everything affecting a cancer patient, from the diagnosis to our side effects and late effects, to legislation around survivorship. I wanted to be as involved as possible to give that patient perspective, because oftentimes we talk about having a seat at the table, and we hear that a lot. Nothing about us without us. Those kinds of cliche things that we often say. But the truth of the matter is even if we had a seat, we never had a voice.
Mm. Yeah.
Right? So we're the patient representative, and I wanted to move beyond that. And how would I move beyond that if I didn't build credential in the area of patient in the area of patient advocacy? I think that's what drives me, not to be the seat at the table, because I've never really been interested in that. I've always been interested in policy and how we're going to change behavior and how we do things on a daily basis. And just hearing from me isn't all that important.
So what's the difference then to you between having a seat at the table and truly having a voice? Like, how do you know when your efforts are having a voice rather than just a seat at the table?
Well, I give a good example. For patient advocates, we are usually invited to something like, a conference or a webinar, and we are the very first 5 minutes on the agenda, right? And we are often asked to tell our story, our cancer story, and do it in 5 minutes, nonetheless, right? Because they've got other things to do. But as soon as we're done, then it's like, okay, well, thank you for that. That was inspiring. Now we're going to get down to the real work of why we're here. Mm-hmm. So we are in essence like entertainment, to get the crowd going, kind of thing. And I think that's the crucial difference. When you can see that all you're being asked to do is share your story. For some, that is incredibly important to do. But if the story isn't going to be a part of the agenda, mm-hmm. and why we're going to do anything today in this body or at this event to do anything about that story, then I think those are the crucial differences. That's right. The seat at the table versus the voice at the table. Yeah. What did you hear about my relationship with my oncologist that can change the way oncologists talk to patients? Mm-hmm. Right? So it became, for me, stop being in environments where you are just like the warm-up. Mm-hmm. If you are not going to pass the mic and then be a part of the discussion, right? Then I just shared my story, or as we're saying now, our lived experience, right? Mm-hmm. I think that's the most crucial part of how patient advocates need to move forward. We need to grow. We need to learn other people's perspectives. And so then when you get that seat at the table, that your voice it can go beyond your lived experience. Right. I've seen this happen so many times. We can talk about our particular story, but if we're asked, well, what do we need to do to bring more minorities and help them participate in clinical trials? Well, as a Black woman, I should be able to speak to that.
Mm-hmm.
I should be able to tell you more information about how you engage people from Black communities.
Right.
And that's where you hear my voice, as opposed to me just sitting here going, yeah, I was involved in a clinical trial and this is what happened to me. That's my story.
Right.
But how do I tell you more about how to affect policy based on that lived experience? And that's where we start to, that is crucial for patient advocates to start making those connections.
Wow.
Otherwise, we're just jump on the bus, wear the t-shirt, we're going to the hill,
Right.
And if that's
And
your
I
thing,
think,
cool.
sharing your story is an important start, but you're right that it's got to go beyond that. It's not just about your story, but what does that mean for how we need to change the system?
Indeed.
Mhm.
Indeed, because especially if your story is 5, 10, 15 years old
Mhm.
and things have changed,
Right.
right?
Yeah.
Treatments
So,
options have changed. What value, the story is valuable, but what value does it bring to today and the
yeah.
discussions today?
But, of course, you're always still living the story because you're never done with cancer and you faced a second cancer diagnosis in the middle of a global pandemic.
Yeah.
So, what was that like? And how did you manage to continue your advocacy while going through treatment a second time?
Surprisingly, I believe it ramped up during COVID.
Yeah.
And right after the kids, my twins graduated, we thought we were going to do so much more because they had just gone through 4 or 5 months of COVID, and we were all stuck in the house, and we just everything's going to get better in the summertime. And then I got diagnosed. Interestingly enough, I think this 3D imaging was able to catch mine because it was very, 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 very small. No lump, nothing like that. It was just a matter of postponing my mammogram because of COVID. And so when,
Mhm.
the hospitals opened back up, I went right in and got it. And it was one of those scenarios where they take it once, they come back in, they take it again. And you're like,
Mhm.
uh-oh, right?
Mhm.
And yeah, so it ended up being a very early stage triple positive breast cancer. But here's the coolest part about this whole journey. This time around, I wasn't afraid.
Mhm.
This time around, I had a voice. This time around, I had a network of patient advocates that I knew, oncologists and researchers that I knew, where I can say, I just did this. What's the next step? I just got this test result. What does this mean? What questions should I be asking?
Mhm.
And the most important thing I love to share is that because of a patient advocate, I learned about accelerated partial breast radiation. I was able to then take that to my oncologist and say, I don't think I need to do 33 consecutive radiation treatments. And she was like, oh yeah, this is the standard of care. This is what the NCCN guidelines say that you should do. And I was like, no, because here's what the research is saying. And it was interesting because this oncologist said to me, well, Kimberly, for every research study you could bring me, I could bring you one that would, be against what you're saying. And I was like, right. What I did learn in that process, again, another aspect of advocacy is in breast cancer, you have to interact with your radiology oncologist, separate human being, separate person that you could talk to that does not necessarily have to agree with your oncologist, but they don't tell you that, right? So
Right.
of course I go into the radiology oncologist with the study and I say, hey, do you know about this Florence trial? And he was like, yeah, I do. And I said, I'm close enough in age. I'm not quite in the age cohort, but I'm close enough. And I'm still early stage triple positive. And so we together decided that instead of me doing 33 consecutive treatments, I would do 5 over 10 days. That's shared decision making.
But
And
you're the
that
one who brought it to him, right?
Oh yeah, I'm sure, I wonder, I often wonder after I left, would he recommend that to the next woman,
Mm, yeah,
right? Who maybe didn't know research, didn't know how to look up, studies and research and things like that. And so that's why I think it's so incredibly important for us as patient advocates. When we learn, we then educate.
right.
Right. So this time around, it was the same old song, losing the hair, neuropathy, being tired, all of that. But I was so much more in control.
Hmm.
And I was a part of the decision making. I literally sat my whole team down when I was first diagnosed and said, we need to have a care team meeting. This is my primary, my cardiologist, my new oncologist, the surgeon. And they were all looking at me like I was bat crazy. Uh, and I was like, no, because I understand that Herceptin is really kind of hard on the heart. And with my ovarian cancer diagnosis and that treatment, I almost died because of the first chemo that was
Mm.
given to me. So I wanted everybody on board. And I don't think they humored me. They all crowded into one office space on a telehealth visit. And I think it was so important for me to see everybody's face in that room
Hmm.
and to see that I was actually being cared for this time around.
Yeah,
But I also think it was my voice and my
right,
my need to be in control of my
right.
own cancer care.
Yeah, because not everybody has that. I mean, you have to be able to be that kind of advocate, self-advocate that you were to be able to make that happen. I'm glad you were able to do that. But like, how do we have to work to make sure that the system works for everyone, like so that that's offered to people without you having to know that you need to ask for that.
Indeed, I was very much on top of palliative care this time around. I was like, oh no, I get it now. I need to see a doctor now. What's
Mhm.
available for me? And it took my oncologist aback a bit, you know, but this time it just didn't matter. I mattered
Yeah,
more.
right. Wow. So, Kimberly, what advice would you have for people who are new to advocacy, patient advocates, or even people who've been involved in advocacy? You talked about growth and how important that is, but what kind of advice would you share?
If you're new to advocacy, the internet is your friend. Find your cancer type. If you're an ovarian cancer patient, then it's the Ovarian Cancer Research Alliance. It's the National Ovarian Cancer Coalition. If you're in breast cancer, of course, it's Komen. And there are various other organizations, but take some time and seek them out online. Secondarily, most of these advocacy organizations have scholarships that will allow you to go to both medical and scientific conferences. For ASCO, as well as AACR, is a great opportunity for patient advocates to learn more about the science of cancer research, of cancer, should I say. Get involved locally. Find your lane, as they say. Some people like to do support, right? Some people like to do awareness advocacy where you're going to health fairs and things like that, where they share their story. Find out what you like and don't stop learning. Find out if you want to do legislative advocacy. Find out if you are somewhat of a science geek like me and you wanted to learn more about research advocacy. Um, there are often opportunities for you to do things on a volunteer basis, as well as being paid as a patient advocate. So,
Mhm.
there all these new opportunities are being afforded to us. So, but for those who have been in patient advocacy for a while now, again, I can't stress the importance of growing. right? You keep saying yes to everything, but what is it doing for you? How meaningful is the work? When we start talking about patient advocacy burnout, you have to ask yourself, why are you burning out? I get excited every morning knowing what's on my agenda to do, right? Because I've designed that agenda,
Mm-hmm.
right? I haven't just been saying yes, 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 yes to everything. I have a path and I know exactly what I plan to do and the things I want to accomplish. It's again being in the control seat versus the passenger seat.
Mm-hmm.
And I think that's how we are in patient, the whole idea of being a patient advocate. It depends how you came into becoming a patient.
Mm-hmm.
If you listen more to your oncologist, or you have a shared bi-directional kind of relationship, that I think that determines your advocacy, right?
Right.
Which lane you actually end up in. And wherever you're comfortable, that's where your 100% contribution is going to be. And we want you in every aspect of advocacy. We just need more in research advocacy.
Right. Yeah. And I mean, there are so many ways to contribute, and it's a matter of what's of
Yeah.
interest to you and where you want to spend your time and, uh, and talents, because it is a lot of time involved. And like, especially research advocacy, you have to learn a lot about the science
Oh,
to be able to participate. But you can make such a huge impact by helping really shape the future of, the kinds of studies that are being done and how they're being designed and how they're being conducted.
yeah. I think like you said, and again, advocacy, we all sat in that infusion chair. You're okay with me regardless. All right. So I want to make sure that that's clear. We've all had that experience. We've all come through that. We all have to deal with side effects, late effects, the emotional and mental stress of that diagnosis. So in any area that you want to serve is perfectly okay.
Yeah. All right, I have one more question I want to ask you. And this is really a big one, but you can share with us a little bit about, because health equity is so important. And I know that a lot of your work in Chicago and on a national level has been about health equity and trying to improve uh, health equity and reduce disparities. So can you tell us a little bit about what you've done and what do you think we need to do still
Oh,
to get to a
goodness.
point where we have equitable cancer care?
Well, I'll start with the last question. I think that it's a leadership question. I don't think I don't think yet that we're at the place where leadership is making a decision about diversity and inclusion. I think that we're having an awful lot of discussions about it. But if you notice who is on those panels, who are on those podcasts, I think if it was a national or a leadership direction, we would see it in the media at this point. Instead, what we continue to see is within our neighborhood, within our community of advocacy. We see a lot of webinars where there are panels of people, and oftentimes people that are not completely representative of those particular communities. I think just recently we're starting to see more persons of color actually being asked onto panels about what they think is important regarding health equity. There's a great article that's just recently been published about health equity tourists,
Mm-hmm.
how there's money that's coming in, and more people are, because they're researchers, are now saying, oh, I can address that because you have the years of experience with research methodology. But where is the same comparable years of experience uh, dealing with this from a public health standpoint? So what we're seeing now is this proliferation of researchers talking about health equity talking about disparities in clinical trials, talking about disparities in medical care. But those same amount of years are not there where there are so many other persons of color credentialed that have been publishing or attempting to publish on these very topics. So I think we need to do a lot more work at when, for example, NIH or NCI puts out a large implementation grant, find minority researchers to do this work alongside, because you're still going to come with the same information, largely due to implicit bias. You just can't, you won't be able to have a rich discussion around patient engagement or patient inclusion when you don't have that patient population sitting at the table, and you don't have the researcher who's been doing that kind of research for decades, talking about these issues. And so what I've been largely involved in is working with researchers from the very beginning. So I'm really pleased to be able to be on advisory groups regarding research design before the project even gets started, before you've got your IRB application, before you've even been funded. Are you thinking about how well you're going to include people of color in this study? And I think that's where my role actually can be of most benefit. Yeah. At the very beginning. And I think that's true of all patient advocates, quite honestly. But when we are trying in these areas to include more people of color, I think more minority patient advocates need to be at that table.
Right? Well, and that's the difference between being at the table and having a voice, is when you're part of shaping the project, not just, you know, putting your name on it as saying you recommend it or whatever. It's when you're actually part of coming up with what's the idea, what are we going to, it's a question we're going to be studying and how are we going to study it. When you're part of that, then you're really having a voice, not just a seat at the table.
Yeah, indeed. I mean, we've been, for a long time, we've been asked in the 99th hour to review an abstract. Yeah. What does that do, right? When we didn't get a chance to really look at the full design. Right. So, but you have to want to read that full proposal too. Right. So it's a two-way street, definitely. Yeah.
Kimberly, thank you so much for your time today. Congratulations on the very well-deserved honor of the Stovall Award. I am honored to know you and to get to work with you, and excited to see all of the incredible work that you do for patients in your community and across the country.
Shelley, I just thank you so much. I appreciate you on so many levels, just from day one, meeting you through Elevate and being a part of the NCCS family. This is, like I said, it's a full circle moment. So I'm so grateful to everyone, again, who nominated me, and to the NCCS staff. So thank you, Shelley, for having me.
Thank you. We're so proud of you.